Hello, I'm Tony DeMaria, the editor of JACC, and we're here with another edition of the Genuine article where we discuss really interesting papers that have just been published in JACC. And I'm here this morning with Philippe Pibarot, who's a professor of medicine at Laval University in the Canada Chair of Valvular Heart Disease, and as well with one of our associate editors, Joran Bax, who was the individual who oversaw the paper that we're going to discuss. And it's really interesting to note that despite the fact that mitral valve annuloplasty has been done therapeutically for some period of time, there's relatively few data as to the consequences of annuloplasty, particularly restrictive annuloplasty, upon transmitral hemodynamics and potential mitral valve obstruction. And that was the subject matter that Dr. Pibarot set out to study. So Philippe, can you tell us about your study?
Yeah, in a previous work, we looked at the outcome of patients with ischemic MR following restrictive annuloplasty, and we found that about 20 to 30% of the patients have persistent or recurrent MR following operation. But in this study that has just been published in JACC, we specifically look at the group of patients who have a successful result in terms of correction of MR, so no persistent or recurrent MR. And we noted that there was a variability in the response to surgery. Some patients improved well after surgery in terms of symptoms and functional class, others not as well. And we hypothesized that this restrictive annuloplasty could cause an obstruction to the antegrade mitral flow, could cause a functional mitral stenosis. So we studied a group of 24 patients with ischemic MR 1 year after restrictive annuloplasty, and they underwent a resting double-time stress echocardiography as well as a 6-minute walk test. And we compared the result obtained in this patient to a group of control patients with coronary artery disease who were matched for age, gender, and LV ejection fraction. And the most important result was that the mitral gradient was markedly higher, threefold higher, in the patient with restrictive annuloplasty than in the control subjects.
And how about a resting level? How high was the resting gradient?
The resting peak gradient was 5 millimeters of mercury in the control subjects and 13 in the patient with restrictive annuloplasty. And this, the presence of high transmitral gradient was associated with increased pulmonary arterial pressure and reduced 6-minute walk test distance. So the most important finding is that a substantial proportion of the patients who have a positive result, a successful results in terms of correction of MR, may nonetheless have some degree of functional mitral stenosis ranging from mild to moderate, close to severe in some patients, and that this is associated with the reduced functional capacity.
So Joran, you were the associate editor for this paper, and as you analyzed it, what did you think were the really good points and what were the limitations?
Well, I think the really good point, so to say, is that this highlights indeed a technology that we have been using increasingly over the recent years, specifically with the increasing number of patients presenting with heart failure, large ventricles, need bypass surgery. Then the question comes up frequently, should that mitral valve be repaired as well? With annular dilatation, there is very often severe mitral regurgitation. So I think clinically very relevant study that you have performed. The thing that came to my mind is when I saw these data, first of all, it's a limited group as you have it so far. And the second thing is that what are the implications in terms of prognosis? Do you feel that this would alter prognosis, the findings that you have shown?
Well, I think that's a very good point. And the next step is to determine whether this hemodynamic and functional abnormalities that we see in these patients would translate into higher morbidity and mortality rates. But we know from the patient with heart failure that generally a reduced 6-minute walk test distance is associated with a poor prognosis. But again, I think we need further studies to address this point.
So is it your view that we've traded one disease for another? We've traded mitral regurg for mitral stenosis?
Yeah, and kind of, yes. I think we trade one disease for another, and then it is to say what is the worst or the best. And in fact, with this disease, we face an important dilemma, because if you put a prosthetic ring that is not small enough, that is not enough restrictive, you may, of course, increase the risk of persistence or recurrence of MR after operation. But on the other hand, if you put a prosthetic ring that is too small, you may cause some degree of functional mitral stenosis. And the safety margin is, if you will, is relatively narrow.
Well, I agree. The number of patients was rather small, and it's only 1-year follow-up, but data in this area are precious few. And so this, I think, as Dr. Back said, was an important study. I'm not quite sure. I think perhaps the take-home message is that we don't want to use restrictive annuloplasty unless we're sure that the functional mitral regurgitation is really causing a problem for the patient. And I'm not quite sure how to do that.
Yeah, and in fact, that's a very important point, because I think that we have to remember that in essence, ischemic MR is a ventricular disease and not a valvular or annular disease. And in this regard, restrictive annuloplasty targets the consequence of the disease, so the MR, but not the cause of the disease. So I think that these data are probably provides an impetus for the development of new alternative or concomitant surgical procedure that would allow for long-term correction of MR without inducing the functional mitral stenosis. And in this regard, there are several surgical techniques that are currently under investigation.
Good. Well, we'll keep an eye on that, because clearly we haven't solved the problem of functional ischemic mitral regurgitation just yet. Thanks very much for viewing this issue of the Genuine article.